Mortality rate for COVID-19 has been averaging around 1,000 deaths per day for several weeks, according to data from Johns Hopkins University. But there is some good news.
The U.S. Centers for Disease Control says that COVID-19 deaths are expected to start declining over the next week. Chief Health Editor Dr. Nandi joining us with more on this announcement. Dr. Nandi, this is good news.
Yeah, for a change, right? I'm giving some good news, Glenda. So good afternoon to you and Alan. And here's the thing, right? We're expecting to see the number of deaths drop because of a couple of reasons. One, the efforts taken by states to control the virus are actually working. So things like encouraging face masks, social distancing, controlling crowds, and closing restaurants and indoor bars are really helping to curb the spread of this virus. And secondly, because of these health guidelines, it's much harder for this darn virus to infect a human host. And so case numbers are dropping, and they've been dropping steadily since the end of July. And once case numbers drop, guess what? Then death rates typically follow suit, but they do lag behind infection rates. And that's because it takes time for a person to become sick, get hospitalized, and potentially pass away.
So the mitigation efforts are working, and that is good news. But not all states seem to be getting this virus under control, and particularly middle America.
Yeah, and that's the not so good news, right? States like Arizona and Texas were hit hard during the summer, and they did implement public health guidelines that impacted their case numbers, so we're going down. But some states in middle America, their numbers are actually not falling, and the death rates are actually increasing in several states like Nebraska, Oklahoma, Kansas, and North and South Dakota. So hopefully they will take the right steps, as I mentioned earlier, and I'm confident they will, controlling crowds, closing bars to curb the spread of the virus in their states.
So, Doc, mitigation efforts really do work, which is why it's really important to rein in what's often referred to as super spreading events. Those do help drive the pandemic, don't they?
100%, Alan. So parties, conferences, rallies, any place that a large gathering of folks are all considered to be quote unquote super spreading events. And here's why. Researchers looked at data, for example, from the Georgia Health Department that included over 9,500 COVID-19 cases. And they found that roughly 2% of cases caused 20% of infection. That's a big number. This really shows that this virus has an extraordinary ability to spread from human to human, and that's why we need to be vigilant, be careful, and not let our guard down. So please continue to wear your mask, wash your hands, social distance, and avoid crowds. And guess what? If you don't need to have a big party, please do not, I beg you, because we'll get to the parties later on, but let's get this virus under control first.
All right, that is good advice, Dr. Nandi. Thank you so much. We appreciate you joining us. Happy Friday.
Happy Friday.
Be sure to join us for the Dr. Nandi Show this Saturday, 5 o'clock, right here on Channel 7.